Happy Friday, everybody, and welcome to the absolute greatest, best show ever about plastic surgery, health, and beauty. This is Nip Talk. Today, we got some great segments. First off, a plastic surgeon is arrested for his wife's surgery death. We talked about this one in the past, but we got some crazy updates. And then, Mastic gum, can it give you a jawline like Brad Pitt? We're going to talk about that. And finally, Retatrutide, a new drug that's a triple version of Semaglutide. This might be a game changer. We're going to tell you all about it, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We super do appreciate it. Please hit that like and subscribe button. It helps us out a bunch. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the amazing Sarah.
Hi.
Hi, amazing Sarah.
Hi.
How are you today?
I'm good.
Your outfit's on point today.
Yes, Barbie. Avery picked it out.
Nice.
The little one.
Travis, how are you, buddy? You having
I'm
a
great.
good week? Yeah, everything good?
Yes, indeed.
Anything exciting happened? Did you get to meet the president again?
No, nothing exciting has happened this week.
Dude, every time I see you, you got some crazy story about
I know it right now.
Your life is like, you're like the main character, man. We're just NPCs in your world.
No, I will say this. Tomorrow, I'm hosting a fashion show.
What?
That's cool.
Where?
I don't know the spot exactly. I need to look at the flyer, but it's the 6th annual Elite of Dallas fashion show. It's like a streetwear fashion show.
That's
Get
fun.
out. Like, is it somewhere, is it open to the public? Can we like come crash it?
Yeah, you can. I'll send you the invite. I got you. And it's not an invite only. I mean like the flyer.
I have one thing going on tomorrow, man. If I can make it, I will definitely come by. So are you judging or are you hosting? Or?
I'm hosting. Me and a friend of mine.
You're hosting it?
Yeah, we are hosting.
Dude, well,
That's
you're
so
like gonna be all like in practice from all like the fashion stuff we do on the show. You'd be like, I got this.
Absolutely.
You're like, I'm pretty sure that's on trend.
Yeah, Sarah has trained me very well. She's trained me for this moment.
Now, is this like gonna be on social media as well, or is it just like live only?
I don't think it's gonna be live. I do believe there'll be like camera people there capturing everything, but I don't think it's gonna be live anywhere.
Dude, please send me the info, man. I actually would love to come by and see you like do this, man.
I would do.
I think that's awesome.
I will do. I'll send it to you. I got you.
Awesome. Sarah, anything exciting for you?
No, just a
Same old stuff?
normal weekend.
Normal week?
Yeah,
Yeah.
nothing huge.
I actually had something pretty cool happen. So I do these like little segments for radio or TV or whatever. So there's this one radio show out of Cincinnati I've done, probably 20 times. I'm on there like every couple weeks, and they hit me up for talking. Actually, it's a topic we're going to do today. It's our second topic. And anyway, so we did the thing, and I was just talking to the guy afterwards, and I was like, yeah, I should come out there and like be a guest host for your show sometime. They're like, yeah, dude, come do it. And I was like, really? They're like, yeah.
Nice.
So I think I may actually go do it. It's just a talk radio show in Cincinnati. It's Eddie and Rocky. I think they're kind of known. I don't know.
Their names sound fun.
They are actually really funny. Like, I actually like them, and we always have a good time when we do these like little segments together. So yeah, because the show's in the middle of the afternoon, I can literally fly out in the morning and do the show with them, and then be back the same day.
Yeah.
And
That's
then
dope.
yeah, I thought that'd be fun to like do that and like live stream it. Like we could live stream it to the channel. And
Absolutely.
That'd be fun.
yeah, so I think I'm gonna do that because why not?
You
It sounds
should.
fun, and it's good content. And
I will say this: once you do radio, it's like getting bit by like what do you call it? A raccoon.
like I'm gonna get rabies.
Kind of, sort of.
Start foaming at the mouth.
You're gonna become a fiend for the radio.
Yeah, you're gonna become a fiend for the radio. It's like a good, bad feeling.
Really?
Kinda.
Dude,
Yeah.
I actually am really excited about it because I like this kind of stuff. I like doing live streams, and I really like doing the live TV and live radio stuff that I do, and of course like doing the show. So
Yeah.
I think it'd be super fun. I think Kaylee from the marketing team may come with me so she can like do all the camera work.
Document it.
Yeah,
Nice.
right.
That
Yeah.
should be really. Bring some footage back so we can put it
I
on the
will
show.
for sure. Yeah, absolutely. So yeah, they're just checking because I was like, look, if I come out, I really want to like live stream it. Just make sure that your network is okay with that. And they're like, we don't think it'll be a problem. So I'm waiting to hear from them. But
Absolutely.
I think it'd be super cool. So I'm excited about that.
Congratulations.
Fun.
It'll be fun. All right, well, let's jump into some segments talking about well, we weren't really talking about segments, but let's jump into them anyway. So I have like a really big update on a segment that we did in December, and it was about the plastic surgeon whose wife died while he was doing surgery on her. Well,
Yeah.
she went into cardiac arrest while he was doing surgery
I
on her.
literally was just on social media and
What's that?
saw an article about it.
You
like
just saw it?
literally saw one.
Yeah.
Just right off the
And
bat.
so when we did the segment, it had like just happened, and there was really not a lot of information out there. So just to kind of recap, so this guy, he's a legit plastic surgeon named Dr. Benjamin Brown. Was operating on his wife at Restore Plastic Surgery in Gulf Breeze. And the short version, and we'll dig into a little bit more, is that she had a seizure and went into cardiac arrest. And then she went to the hospital, and they said she was brain dead, and she apparently
my
died like
God.
a week later, which is terrible.
Was it local, or is it?
Well, I'm going to bring up a clip. So, so now that 7 months have gone by, there's this huge investigation, and this week he was arrested, and he was arrested for homicide and negligent manslaughter. And like I said, when we did the segment back in November, there was not a lot of information, just that there was a plastic surgeon, his wife was having surgery, she died. But I speculated on it, so I want to roll the clip from last November, and please excuse my hair, because this was in my Ken phase, so all right, roll that clip. So the little bit of details. So I got this from all the news articles. She was having multiple procedures. The patient had multiple seizures in the OR before she went into cardiac arrest. In the 911 transcript, it was stated that the doctor possibly over-medicated the patient. Okay. The doctor stated that he used a different medication due to the regular medication being unavailable. So all of that to me points that they were doing surgery under local anesthesia. Now, that was not stated anywhere, but all of those things kind of fall in line because local anesthesia toxicity, the most common thing is central nervous system problems, of one of which is seizures. I mean, that's kind of the classic, serious complication from getting too much local anesthesia is you have a seizure. I really am kind of against people doing major surgery under local anesthesia. Mm-hmm. All right, so now that a full investigation has been done, that actually was exactly correct.
Nice.
That
you knew.
Well, I mean, I can't say that it was like a genius call, but it was a smart call. I mean,
Yeah.
based on what they had said, it
All
was
the clues.
Yeah, it was most likely. So there's a lot more information. And when we did this segment, I kind of gave this surgeon the benefit of the doubt. I was like, well, maybe this was just really an unfortunate, accident or some mistake happened. I've changed my tune. Now that I know the details of this, it's pretty egregious.
He was just being careless.
It's pretty bad. This is really kind of just flat out. I mean, I'm not surprised at all that they arrested him, and I think without question, well, I don't know. I think based on what I've read on the details of this report, I think there's no chance that he gets off on this.
Do you think he did it on purpose?
That is very interesting and something that we can pontificate on. I don't know.
He purposely was like, maybe I could just kill her and
Well,
make it look like an accident?
Let me tell you guys the story, and you tell me what you think. All right, so a couple things have happened. First off, the health department restricted his medical license this spring, said that he basically could only work in a licensed hospital under direct supervision of another surgeon. So they did go into detail about what surgeries she had. She had a abdominal scar revision with muscle plication. So what that means is she at some point had an abdominoplasty, and probably she had some healing issues along her incision, which is actually pretty common. And then she probably had a little bit of relaxation of the rectus muscle repair that's done. So they were doing a scar revision of her abdomen and a rectus muscle plication, liposuction of her arms, lip injections, and ear adjustment, which I'm guessing is an otoplasty, meaning her ears maybe stuck out a little far, and so he was doing a ear pinning. I guess that's the only thing the ear adjustment would mean to me. Here's where things get weird. The patient, the wife who passed away, prepared her own tumescent IV bags, meaning she mixed up her own drugs that she was going to be given.
Is she a medical?
No, she's not. And that's another thing, is that this guy has had several people in his office doing medical procedures or, things medically related that they have no training for. So she mixed up her own tumescent IV bags and then took a bunch of pills. They didn't. That's just all it says is she took like a handful of pills. There's no documentation of what she took in the records, which is the reason that they really went after this guy. He didn't document what was in tumescent fluid. So tumescent fluid, for those who don't know, when you're doing liposuction, you first inject fluid in, and that fluid has lidocaine, which numbs it, epinephrine, which keeps you from bleeding, and bicarbonate, which keeps all those medications there. So that's what tumescent fluid is. You inject that in to saturate the tissues, and then you suck out the fat. They didn't document the properly what was in that. So they started doing the procedure. It gets even weirder. The patient started closing her own incision, is what that the documentation says. She started closing her own incision because it's awake, right? It's a local.
In her abdominal area?
I guess it doesn't really say. I mean, it has to be that because I don't know what else it would be. But then she started to complain of the symptoms of lidocaine toxicity. She started having muscle twitching. She said her vision was getting blurred and she felt unwell. And this is where really I just want to throw the book at this guy. So instead of like stopping, the guy continued to inject her with more lidocaine. In fact, they ran out of tumescent fluid, and per this report, he started injecting just straight lidocaine into her to keep doing the procedures. And then that's when she started, like shortly after that, she started having seizures. Like
Gosh,
to me, that's just unacceptable. I mean,
Did he take the handful of pills?
Maybe, I don't know.
Was he on drugs when he did this?
I'm not sure, but like that's just not acceptable. If somebody's having symptoms of lidocaine toxicity, and there's no world that exists ever that you should continue to give them more lidocaine. That's just absolutely insane, because when you inject that stuff, it doesn't just instantly work. I mean, some of it gets stuck in the tissues and then it gets absorbed. And so even if they're just having mild symptoms, even if you gave them none, they could go on to like seizures or, cardiac arrest. Why in the world would you give them more? It just makes no sense whatsoever. So when she had a seizure, the medical assistant asked several times to call 911. The guy refused. He's like, no, I can handle this. I can handle this. And so they're saying it up to like 20 minutes went by after she had a seizure before they either called 911 or started CPR. Which is
she like dead?
Did she die?
I mean, was she like dead within those 20 minutes whenever?
Well, it didn't say
911 was
specifically at
called?
what point she went from seizure to cardiac arrest, so I can't answer that for you. I mean, at the point someone has seizure, you need to start some life-saving things like airway, oxygen, all that. Apparently, they didn't really have any of that kind of stuff there, which is the reason that you really just need to call 911 like immediately, because if you don't have the stuff that you need. So yeah, that's pretty insane. That we did a story very similar to this where there was a doctor that someone went in cardiac arrest and he refused to call 911. So
So much pride.
yeah, big time. Health department found some other violations. Oh, this is crazy. So this patient did 2 BBLs on patients who didn't ask for them, allegedly, meaning they came in for one surgery. I guess they came in for liposuction, and then they just wanted liposuction, but then he injected the fat into their butt without their permission. Like, that's crazy. I mean, that's straight up malpractice.
That's creepy.
Yeah, and so, and then also I talked about him having people in his office doing unlicensed procedures. So yeah, I mean, after hearing kind of the details, of course, this is all from the report. This is all public information. I mean, based on what they're saying, I mean, this is just beyond malpractice. I mean, obviously it is because they arrested him, right? You don't get arrested for malpractice. Like, this is negligent homicide, and I don't know.
There's something wrong with him.
I mean, I don't know. I mean, there might be. I mean, based on like all these things that he did. I mean, a lot of these things that he did where he had, I mean, you're having the patient sew themselves up when they're not, even if they were a medical person, like having them sew themselves up, like that's
weird.
That's just weird and crazy. And then, not calling 911, and then also,
especially for your wife.
I know, right? I know, it makes no sense.
I feel like doing surgery. I mean, and I don't know if you've ever done surgery on your wife, but it's like I feel like that's like a lot of pressure.
So it's funny.
I mean, that would make me feel a lot of pressure. Like if I had to do like surgery on Avery or something.
Yeah, I mean,
if I was a surgeon,
and I'm going to bring this up in just a
scary.
second because there's more to this story. We talked about this the last time when we talked about this very same story. So I've operated on my wife, both my kids, my mom, my brother. I think that's it. So I mean, I personally, I think if you're doing something that is very, routine and not life-threatening, I mean, I don't have any problem doing that.
Yeah.
There is definitely some criticism if somebody was doing like major surgery on a family member, and that generally is not allowed.
Yeah.
But I mean, like I said, I've done surgery on all my family members, but it's like, the stuff I do is not life-threatening.
Yeah.
And if something were to go down, typically the anesthesiologist is the one who has the best advanced cardiac life support. I mean, I used to run codes all the time when I was a trauma surgeon. Those days are past for me. I mean, I still know the ins and outs of it, but I mean, if a code happens in the OR, the anesthesiologist is going to run the code.
Yeah.
So, but it's interesting that you mentioned that. So there's been a lot of talk about this in Florida since this has happened. Of course, there's been a lot of outrage about, how bad this situation was. So in classic like government fashion, like these two lawmakers have rushed to make a new law to try to protect people, which honestly I'm all for, because Florida is like the Wild West of plastic surgery. I mean,
it's a weird place.
People get away with crazy stuff out there, stuff that just really
people just do weird stuff down there.
I mean, it is an odd place, and I love Florida. I love the vacation there, but man, it's different attitude out there. So these two lawmakers, state lawmakers, Michelle Salzman and Alex Andrade, have come up with the brilliant conclusion that the reason that this all happened was because it was his wife. And so they're trying to make a law that says that it's illegal for you to operate on a family member.
The reason all this happened is because he thought he could get away with it.
Right. I mean,
like he kept getting away with all the other weird stuff he was doing.
It has nothing to do with the fact that it was his wife. Like zero to do with his wife, unless you're, have something there where he did it on purpose.
Yeah.
Which I don't know. I mean, I'm not saying that at all that that's what happened, and no one else says that. But man, when you do something so egregiously just out of the standard of care,
what was he thinking?
It makes you wonder.
That's why I'm like, was he on drugs?
Who knows?
Was he the one who was like, let's both take some pills together?
They probably would have. They probably would have tested him, I would think.
You would think so.
I don't know. But yeah, I just was like so annoyed. It's like, something happens and people rush to make laws, but they make laws that really have no bearing whatsoever. I mean, how many times has a wife died from surgery that their husband did in the state of Florida? This has to be the first time. I've never heard of that prior. But people die literally all the time in Florida from this exact same thing. Like they're going after the wrong problem.
Yeah, it's the wrong demographic.
Yeah. It's like, it's just not, it's like, it's like if you, it's like if you want to make a law for cars to make them safer, and
how about they can't do local anesthesia stuff anymore?
Right, exactly. Okay, let's be smart. So like, what do I think are the reasons why this person died? Number one, big surgery under local anesthesia. I mean, how many times have we talked about that? Like,
that's what they should put into law.
Yeah, dozens of times. I mean, so many times when people die from plastic surgery, it's from people getting big surgeries under local in very shoddy, facilities that aren't, really equipped to handle a surgery that big and don't have the equipment that they need. Like that is the number one problem here. You did a big surgery under local anesthesia. I mean, literally people die every single month for sure in plastic surgery from that. Why in the world wouldn't they go after that? It makes no sense. I think the other thing too that is really a root cause of this is surgery in an office with no oversight. You have somebody saying, let's call 911, and the doctor's like, no, we don't need to call 911, when obviously you do. You can't get away with that like in a surgery center.
No.
If you're in a place that has oversight, there's no way you can get away with that just level of stupidity.
Yeah.
And so, I mean, if you want to make a law, maybe make a law like no big surgeries in unlicensed facilities.
Abdominal surgery, man, though. That's like serious.
It's pretty legit, yeah. It is, yeah.
You got some vital things in there.
Well, it would be like superficial, right? So if you're placating the
muscles, yeah. But still.
But I mean, doing that under local is pretty crazy. I mean, because that's a painful operation. I mean, the amount of local you'd have
And then she was told to sew herself up. I just cannot.
I know, it's just crazy. And then, the last thing I think causes is just gross negligence by the surgeon. I mean, there's just so many things that were done wrong in this.
That sounds like,
allegedly
sounds like a horror.
It's crazy, right? It's almost unbelievable when you hear it all listed out. Yeah.
That's why I'm like, literally, I'm like, were they like just both of them like up one night, like it's 1 a.m. and they've been drinking or on something?
Let's do surgery.
Let's do a surgery.
No, it was like at
Let's
6
be
o'clock in the
crazy.
evening. It was kind of late in the day, actually.
Yeah, that's what I'm thinking. Like, were they out getting margaritas and we're like, let's do a surgery real quick?
I mean, it's just insane. Like I said, when we did the story the first time, I was like, oh, well, maybe things happened and, it was like a simple mistake. But I mean, there's just a lot of really,
No, you don't.
really,
Yeah, we don't feel sorry for him anymore.
yeah, there's a lot of really, really bad things that happened there.
Yeah.
That, that lady should not have died. I mean,
No.
there was a lot of bad decisions made that were compounded by more bad decisions. And, when someone died from it, and then you get the bad decision of lawmakers to try to fix the wrong problem. I mean, I don't know. It's just like the crazy people are running the asylum.
Yeah, I think he's going where he's supposed to go.
I don't think there's any way whatsoever he'll get off from this. I mean, I bet what they try to do though is they'll probably try to pin it on her that she mixed up the wrong drugs or something, which is still, it doesn't matter. Like that doesn't, make it okay or make it not negligence.
It's so weird.
Yeah, crazy story, right?
I do not approve.
I don't approve either. Like I hear these things and it just makes me mad. It's like, there's people like me out there trying to like do the right thing, and then you have people, in the specialty just doing all the wrong things, and it's just not good for, it's not good for the field of plastic surgery when stuff like this happens.
No, it gives you a bad rep right there.
Yeah, bad rap. Florida, get your act together.
Seriously.
Crazy. All right. Well, we'll see what happens with that. I mean, we'll have to follow that one and see.
Straight to jail.
Yeah, I think that's going to be. I just don't see him getting off on that one.
I hope he doesn't.
Yeah. Okay. So when I was talking about that radio show earlier, I was actually talking about this segment, and I always love when I find something and that I had zero clue existed. Mm-hmm. And this is one of those things. Like I really just did not know that this was a thing. Have you guys ever heard of Mastic gum? Mastic, Mastic gum?
No.
I can't say I've heard of it. No.
Never heard of it either, but apparently there's been some news articles lately popping up about this special gum that allegedly will give you a chiseled jawline called Mastic gum.
Like actual bubble gum?
So I don't think
Gum
it's
you
bubble
chew?
gum, but it's gum. Yeah, it's gum that you chew. Yes,
Okay.
that's correct.
But it's
So
for working out.
So what's different about this gum is it's made out of plant or tree resin, so it has the consistency of gum, but it's much, much harder. Like you basically have to work to chew it. And so there's been these things on like Reddit, various social media that says, oh, if you chew this mastic gum for an hour every day, like you'll get this really chiseled jawline. And so, like I said, the radio station had seen an article about this, and so they called me up to talk about it. And at first I was like, I don't even know what they're talking about. But of course, I can read up on stuff and then, intelligently comment about it. So yeah, I did a deep dive on mastic gum, something I didn't know existed. So there's several versions of this. The brand names are Rock Jaw, Stronger Gum Jawline. That's a few of them, and they claim that if you use these things daily, that you'll get this chiseled jaw. So I was pretty skeptical about this for a couple reasons. Most notably because when you're talking about like working out a muscle, which is how they're saying that this works. Like muscles really don't define your face very much.
Yeah.
Our face is defined by our skeletal structure. Mm-hmm. Yes, there are muscles over the top of it, but these are pretty small muscles in comparison to things like your pecs or your biceps.
Yeah.
And so, there's limited amounts that the muscle size actually changes the contour of your face. Mm-hmm. And in reality, like the jawline itself, that makes the shape of our lower face doesn't have a lot of muscle on the defining points of it. So I want to throw up a pic because the muscle. All right, do you guys know here? Before you don't throw it up, stop. Do you guys know the muscle that lets you chew? Is that common knowledge? I mean, I know it. Have you guys ever heard of it?
I've definitely should know what it is.
Okay, I didn't know. I just was curious. All right, so it's the masseter muscle. So when you chew, it's the masseter. So there's a good picture of it. So the masseter muscle basically originates on your jaw and then inserts on your cheekbone. And so when you flex that muscle, it causes your jaw to close. So when you chew gum, you're working out mostly your masseter and maybe a little bit your buccinator, which is that muscle that's kind of on the inside of your cheek, which allows you to kind of do the kissy face.
Yeah, I don't chew gum very often, and sometimes whenever I chew gum, my jaw will get sore. Yeah.
Probably because your muscle's not used.
Yeah,
used to
because I
being
just
used.
don't chew gum very often.
So my skepticism was that, okay, well, it's going to work out your masseter mostly, maybe your buccinator a little bit. How is that going to change your jawline? I didn't really see it. I mean, if you had like a really massive masseter, you wouldn't necessarily have a change in your jaw. You would just have this kind of like, thicker area out to the side, which, I mean, I guess is part of your face, but it's not really your jawline. Mm-hmm. So I didn't really think that this was real. But, of course, I want to be certain, so I pulled some research articles.
Yes.
And what do you think?
I think it has, I bet it had some noticeable effects-ish.
It has some effects, but not on your jaw.
Okay.
So I was surprised, actually. So specifically to the aesthetics of the jaw, the research shows that you can't really tell a difference. However, the surprising part is that there was actually a lot of data showing that mastic gum is pretty beneficial for other reasons.
Okay.
Which really kind of took me by surprise. And just like further surprising me, mastic gum has been a thing as far back as the 5th century BC. Like people have been like using this gum to do this jaw exercises for like thousands of years. I had zero idea that this was a thing.
Nice.
I know, right? I always like, like you find something, it's like, wow, I didn't know that. It's surprising.
Interesting.
So the research shows that this mastic gum can do a few things. It can decrease the bacterial counts in your mouth, which can result in less plaque, less cavities, and less gum disease. So it's actually really good for your oral hygiene to chew this mastic gum. It also, I don't know how this works, but it's been shown to decrease H. pylori, which is the bacteria in your stomach, which causes ulcers.
Okay.
I would assume that, like when you are chewing, it does send signals to your stomach. So I would assume that constant chewing sends some sort of signal to your stomach, which has the effect on H. pylori to diminish it. I don't know exactly how that works, but if you decrease H. pylori, your risk of getting stomach ulcers goes down. Finally, it has been shown to decrease your overall glucose levels and also decrease your cholesterol. Now, not
maybe because it makes like.
I'm not exactly sure.
Since the sensation of eating maybe makes you not eat so much.
Perhaps that's it. I mean, it might be that, and that might be exactly it. As they say, causation or correlation does causation. It might be, you're exactly right, that when people chew this mastic gum that they're just not eating, they're not snacking as much.
Yeah, because they're not because if they're bored, they're like, I'm just going to eat this.
Yeah. So I was actually pretty surprised to see that this mastic gum has a lot of benefits, but unfortunately it doesn't really have the aesthetic benefits that people are chewing it for.
There's a company that I know, one of my friends that goes to my CrossFit gym, their son created, it's like a real thing. It's like something that you put in your mouth, like that, and you chew on it while you're working out. But it's not a gum, but it's supposed to the same thing.
Yeah, when I was looking this up, along the lines of the mastic gum, there's these, I forgot the name of them. There's a name for these specific exercises that you do with your mouth to strengthen your facial muscles, which allegedly is supposed to help. But I don't think there's a lot of research to show that makes a big difference either. It's like the people that try to exercise their neck to keep from getting, neck fall when they get, older.
Yeah.
I don't think there's a ton of research to show that makes a big difference.
I have no idea. But that guy, he lives in Hawaii and makes money from selling those things.
What is it, like wax or something?
No, it's literally, it's a plastic, a rubbery thing, and you stick it in your mouth in the front part right here. And you just chew it.
You just bite on it?
Yeah.
That's so funny. It's like the athletes in various sports who chew on their mouthpieces. Same thing.
But it's it literally looks like a little cylinder type piece of rubbery silicone
plastic. Like a dog chew toy?
Yeah.
For people?
That's little.
Does it have a squeaker in it?
I mean, that would be cute if it did.
I don't know. Would you guys try this mastic gum? To me, I don't know. Sounds like a lot of work, honestly.
Yeah. I don't know. I mean, if it's easy to come by, if you could just
I think you just order it online.
Oh.
I don't know if you can get it at a pharmacy or, I don't think you can get it at a gas station. I'm not sure. Have you guys ever seen? I've never seen
I've
it.
never
I don't
seen
think
that.
I want it from a gas station. I could be wrong, but I
I
don't
mean,
think I
but
want
like
it from a
if
gas
you,
station.
whenever I go to the gas station and I'm like, I'm gonna get some gum,
Yeah.
and I'll pick up gum from a gas station.
The reason I think I wouldn't like it is because when I chew gum and it gets hard, I'm spitting it out. I don't.
Yeah, the way it's described, it sounds like you're like just like putting like dough in your mouth,
Yeah, no.
like some type of dough that you have
I'd
to
be like trying to blow bubbles with it. I'm sure it
knead
doesn't
or-
blow bubbles. I'll be like trying to blow bubbles.
and you just like spit it out on somebody.
I'm gonna try it just as if I can find some. I'm gonna check next time I go. I'm gonna ask the gas station. Do you have Mastic gum? They're like, what? What are you
They're
talking-
like, get out of here.
yeah,
we don't want that.
Get out of here right now. No.
They're gonna be like, no, we don't have Mastic gum, but we have contacts. If you want some contacts, I can put them in your eyes for you.
Gross. What?
they have contacts at the gas station. That's what makes me so skeptical about the Mastic gum. So
Why do they have contacts at the gas station?
I haven't seen that. Is that a new thing?
No, I've seen it like for a long time, but I guess maybe only in certain areas. But yeah, they definitely have
Man,
contacts. at
I'm
the
not
gas
buying
station.
medical supplies from a gas station. That's just
Fact.
like
That's a rule of
sushi,
thumb.
Some
medical
Band-Aids.
supplies. No, not
it's
at a gas
Band-Aids.
station.
Absolutely.
Maybe.
Yeah, maybe some Tylenol. That's about as medical as I'm gonna get from the
Absolutely.
local quick trip or
That's
whatever.
probably
they're like, we got
safest.
some semaglutide for you.
Yeah, I'm surprised you're not selling
Get some weight
semaglutide.
loss.
Yeah, at the gas stations. You can buy it pretty much everyone else these days. So,
Yeah.
well, speaking of semaglutide,
Yeah.
last segment of the day. Moving on to a new one, and I want to thank. There was a user on X that actually put me on this named Coffee Black. He's a doctor somewhere in Texas, I believe.
Nice.
I was talking about segments, and he suggested this one, and I actually didn't know about this, so thank you, sir, for that. So this is a new form of, when I say GLP-1 agonist, does that ring a bell?
No, but I'm assuming it's the weight loss.
Yeah, that's right, yeah. So I tend to just call them semaglutide clones, but yeah, they have a name, they're GLP-1 agonists. So this is another GLP-1 agonist that is along the lines of semaglutide or Ozempic, Ozempic being the brand name for the generic semaglutide.
Yeah.
And as you guys know, we've talked about this in several segments, that the use of semaglutide has just exploded. In fact, I
Yeah.
couldn't get any like really clear data on how big it is. Like I could get data from like a year or two ago when it was starting to explode, and it's like gone nuclear since then. And I know that because every doctor's office, I think, in the Metroplex is selling semaglutide.
Yeah.
Every patient that comes into my office is on semaglutide, and for good reason. I'm actually a fan of the GLP-1 agonists. I mean, people are really losing weight with these things, and it's making a big difference. I mean, some people will be like, oh, it's cheating or whatever. I mean, who cares? Like if you can't go to the gym or get your diet right to lose the weight, I mean, losing weight is good for you. It makes you healthier. So I mean,
Yeah.
who cares how you lose it as long as it's not harmful?
I think it's great, especially in this time when people want fast results, especially when they are struggling to be consistent.
Right.
They get that positive reinforcement
Yeah.
of seeing the scale go down, and I think that gives a lot of people confidence to keep going, so that when they do get off of it,
Right.
they can actually
Yes.
succeed.
Yeah, and you're exactly right that you have to have kind of a change of mindset to, if you want to keep what you've gained or lost in this case.
Yeah.
You do have to alter your lifestyle a little bit, just because as we've talked about in the past, when you stop taking these medications, it doesn't prevent you from gaining the weight back. But that's the same thing when you diet and exercise. I mean, it's the same thing. If you diet and exercise and you stop and you go back to your old ways, yeah, over time you're going to gain the weight back. But I've been a big fan of the GLP-1 agonists. I mean, we have now millions and millions of people taking them for several years, and they've shown consistently good results with very, very few side effects.
Yeah.
And so, you have a product that works really well that, at least to this point, we can't find any harm in. It's like, why wouldn't you want people to use it? So, I know we talked about tirzepatide in the past, the Mounjaro. So semaglutide works by hitting the receptor for GLP-1, which is related to stomach emptying. So what it does is it prevents your stomach from emptying quickly.
Yeah.
Because if you're eating and your stomach empties, then you're still hungry. And so by activating these GLP-1 receptors, it slows the stomach emptying down, and then people feel full quicker. And when you feel full quicker, you don't eat as much and you lose weight. And it's very, very effective. Like, people are really having some pretty good gains from this. With tirzepatide, which is the Mounjaro, it has a second mechanism of action, which is to activate the G1P, which deals with satiety, which basically means feeling full.
Yeah.
Which is very similar. I mean, if your stomach doesn't empty, you're going to feel full, but there is a specific receptor that makes you feel full.
Yeah.
And so things like tirzepatide or Mounjaro hit both of those, and that's why you'll see a little bit bigger gains from them.
That makes sense.
Yeah, right? It's like the more ways that your body is telling you don't eat.
Yeah, 2 pathways to make you stop wanting to eat.
Right, is going to make you lose more weight. So like the difference between something like semaglutide and Mounjaro or tirzepatide, for like medium length, it's like 12% versus 18% weight loss. So you do get extra weight loss from the tirzepatide or Mounjaro because it works in 2 different mechanisms.
I bet I feel like they're gonna start using that whenever people hit a plateau. They're gonna prescribe them the
next one. Well, and with semaglutide, what we normally do is when people plateau, you up the dose a little bit.
Yeah.
Because you can start them on a low dose and see how it goes. And also too, to get them used to the drug so that they don't get too bloated or whatever. And you can increase the dose. But you're right, eventually you will plateau eventually. I think for most people, semaglutide gets them where they want to be. You know, I mean, if you ask the average person, okay, if you lost 15% of your body weight, would you be happy? You know, if for those people who are a little bit overweight, 90% of them are going to say, yeah, that'd be awesome.
Yeah.
And so I think for most people, semaglutide probably is enough. And like I said, we have now tens of millions of people over years using this drug.
Yeah, I have 2 family members that use it, and they're happy
I know
with
a ton
it.
of people that are using it.
Yeah.
You know, some of my really close friends are using it. So anyway, all that being said, there's a new kid on the block. I hate the name, Retatrutide. Retatrutide. I get it. Who comes up with these names? It's hard to say. Retatrutide. Retatrutide. I assume I'm saying that right. So this is an Eli Lilly drug, I believe. And so this one has a third so it has the first 2 mechanisms of action like tirzepatide, but this one has a third mechanism of action, which is to stimulate glucagon receptors. So what glucagon does in the body is glucagon tells your liver to take stored energy and convert it into active energy. So it basically takes the glycogen out of your liver and puts it into ketone energy for your body to use. So what it's doing is not only are you eating less, this drug is actually taking your stored fat and burning it.
Hey, that sounds nice.
It does, right? I mean, you know, they're really getting crafty with these drugs. It's like okay, what are the, you know?
They should make one that's just that.
I guess they could. Yeah,
Especially
I don't know.
for people that are like just want to lose like body fat and not really want to.
I think that it has a limited effect though, because it is better.
Like
I mean,
little boost.
So for example, at 48 weeks, so you're talking that's pretty far. So like 11 months, up to 25% weight loss. So like almost double what semaglutide is.
Nice.
By adding that. Plus people say that they sometimes still feel hungry with this because you're burning. Like it's basically increasing your metabolism.
Yeah.
So now this drug is not yet available though. I couldn't find a date for when it was going to be released. So you can't run out and get Retatrutide except for like the studies that are out there. You know, if you're enrolled in a study, then you can get it.
Sounds promising though.
Yeah, but it does sound very promising. So the problem is going to be just kind of looking forward to, okay, are people going to start using this? Most likely this will fall under patent laws. And so the reason so many people are using semaglutide right now is because compounding pharmacies are making it, and it makes it much more affordable.
Yeah.
Like if you go to buy semaglutide or Ozempic, like the brand name, it's pretty expensive. You know, you're talking, I think it's, you know, like at least $800, $900
Yes.
a month. If you get the compounded version, you're talking like 100, 150.
The generic version, yeah.
Yeah, generic. And the reason that they can do that is because of the shortage of Ozempic, and it allows some loophole with compounding pharmacies to make it, even though it falls under patent.
And it works the same.
Yeah, it works the same. Yeah, it's just a generic. It's like whenever, a drug comes off its patent and suddenly there's all these generics that come out.
Yeah.
It's like with Botox. When Botox patent wore off, suddenly there was Dysport and Jeuveau and Xeomin and all these things popping up because they're basically generic forms of it, and they give them different brand names depending on which company makes it.
Nice.
So although this drug is very, very promising, and
It's going to take a while to get past all the red tape.
yeah, I mean, I could see like people who just have money to burn maybe using it because it works.
It's going to be the new celebrity drug.
It might be, for celebrities. I mean, the cost of it probably will be nothing. Although I bet
it would be good for actors that need to like tone up really fast.
It might be. It'd be interesting to see if the weight loss has a different aesthetic to it, That'd be interesting. I'm not sure if that'd be the case or not, if you could tell.
Yeah. I feel like if it's like it causes you to increase your metabolism, I feel like that would promote the introduction of more protein, more muscle definition, less body fat. I feel like it would make you look more.
I don't think that there's any way it's going to make you build muscle.
I know, but I'm saying like
it might allow you to build muscle easier.
Yes.
It might be.
Because your metabolism is up and you're hungry more. So your doctor would probably be like, hey, the best thing to fuel that is to eat protein.
Dude, that would be the best drug ever if it made you lose fat, give you more energy, and make you gain muscle.
Yeah, but I feel like the muscle part would be on you though.
Yeah, right. You'd have to although now you have
protein.
You have things like M-Sculpt. Have you heard of the M-Sculpt machine?
No.
So there's a machine now, in fact, that they were just at my office this past week. They really want us to buy an M-Sculpt Neo machine. And honestly, I've been thinking.
Does it like work out your muscles for you?
Yes.
It like vibrates? Does it like tense
it contracts them, yeah.
So it's like a TENS unit on like.
On steroids.
Yeah.
I actually did a treatment, not recently, but they've come by in the past, and I did a full ab treatment on it. It felt like I did 1,000 crunches. Like, no joke. I felt like I did 1,000 crunches.
Nice.
Yeah. You can literally put this machine on you and use it, a couple times a week, and you can have a six-pack. Absolutely. And not only that, so the old one just builds muscle. The new one builds muscle, and it has radio frequency energy that burns fat.
Shut up.
I'm serious. These things exist.
You just like lay in a bed and it does it, or you just like walk around with this thing attached?
No,
to
you have to. It's a big machine, so you have to like
sit
lay.
in it.
Yeah, lay down. But you can literally like lay down and like watch TV and get a six-pack.
This
technology,
life,
right?
You know?
I know, right? I wonder where I can just like take one pill and it does it. I mean, having a six-pack is nice, but I gotta like lay down for like 30 minutes a couple times.
So I'm like, isn't that like the Matrix, except in terms of like your body, like making your body look good? Here's one pill for the ultimate.
One pill for everything. It makes me smart, makes me good looking.
Yeah.
Yeah. Well, anyway, really interesting stuff about this new drug, Retatrutide. But as I said, I'm really not sure that we're going to see this be as mainstream as Semaglutide. I think that the main reason Semaglutide is mainstream is because of the ability to get it as a generic, even though it's not. Simple
is best, usually.
Yeah. I think Semaglutide will continue to be the most popular by far, except for people who just have a lot of money. And what'll probably pop up is like these specialized weight loss centers where people go where they can pay extra money and like they can get their Retatrutide and then they can get in the M-Sculpt Neo and get like their six-pack and they don't have to do anything.
Yeah, over a whole
month. The future's bright, people.
Yeah, sign up for a med spa that's 1 month and you come out looking like a different person.
I know, right? Yeah, we've actually been talking about that M-Sculpt Neo machine. It's intriguing. The thing is, I don't think a lot of people ask for it. It doesn't have quite the name recognition as some things do. So you have to kind of sell it, as opposed to certain things like, Morpheus and Halo. People like know that a little bit better. So people will call and ask for it. But yeah, we may end up with those machines. I'm going to roll in one day with a six-pack. I'm going to go for the full 8-pack.
Okay.
Why stop at 6?
Yeah, why stop? Especially if you should just lay there.
All right, well, I think that's about all the time we have today. Thank you guys so much for tuning in. We really do appreciate it. If you have any topics you want us to talk about, leave us a comment. We would love to hear from you, and we'd love to do a segment on something you want to hear about on the next episode of Nip Talk. Sarah?
Bye.
Bye.